Let's speak to Dr. Bharat Pankhania, who is a senior clinical lecturer in public health medicine at Exeter Medical School. Thank you, as always, for sparing us the time, Bharat. Let me just ask you that. There's a new suggestion from the London School of Hygiene and Tropical Medicine. Should we include universities in this closure discussion?
Yes, of course we should. And we should be open about all avenues, all options, and not exclude certain options just because it's inconvenient for us. If it is true that this new strain that is now circulating from South Africa, Nigeria, and the United Kingdom is more infectious, then we've got to do more additional measures to bring the case numbers down and keep them down. Otherwise, it becomes difficult because hospitals will get overwhelmed.
Do you believe that all secondary schools in England should be closed for at least 2 more weeks when school starts?
I said this earlier, is not only the 2 weeks, but to make provisions for a staggered approach or a rotational basis when they open. So the 2 weeks would definitely help with keeping the case numbers down. It's not a long time, but use that period to enable home teaching to the ones that we can do, and then allow the other people who are vulnerable or need extra support or parents can't be at home to go to school, and rotate it. I do agree education is important, but we've got to do something about how do we do it safely.
Okay, well, let's take that example then. A family with both parents working, how would that work in that particular instance, Bharat?
It's difficult. So, as I said, where it is not possible, those children can go to school. Where it is possible, and children can be taught from home, all well and good. But another sector that we mustn't forget is there are children who are vulnerable or need extra support, extra help, and they should also be allowed to attend school rather than just stay at home.
Okay. I want to get your view on this breaking news about the number of new cases. 41,385. That's a new record by about 2,000. Your view on that? This is this new strain, presumably, is it?
I think we shouldn't just say it is the new strain and then let that slip under the radar, because I think a lot of it is also about human to human interactions. So, it is the colder months. We are more indoors. We've been out busy shopping in the lead up to Christmas time, crowded transport, etc. And I think all of those parameters are equally important in causing infection, not only that there is a super infectious strain around and we blame all that on the new strain.
And finally, what would you say to people who, and I sense this is a feeling that most people have, I certainly feel it a certain amount, is that we're in a different world now than we were in March. We're getting an enormous number of cases, but compare that to the number of seriously hospitalized patients and those who are sadly dying. Actually, it's no worse. It might even be better, if that's the right word, than March, April.
No, you are absolutely right. So whilst our admissions are up, our case numbers are up, we've obviously got better at looking after people in the hospital, and we don't have as many people dying upon admission as we had in the March, April period this year. So that's good news. The better news is that we've got vaccines that are also going to be rolled out very soon. And in the meantime, we've got no choice but to have reduced, restricted movements, just allow the case numbers to come down and the vaccines to do its job.
Okay, thank you very much for talking to us. Just a little bit more about that study by the London School of Hygiene and Tropical Medicine. They're saying schools and universities may need...
Thank you so much for your time there, Bharat.
...restrictions.
Thank you.
Thank you. Have a good rest of your day.
...been a political priority.